Hi, everyone, and welcome to the podcast. My name is Andy. I'm the clinical lead at ReadyCare. So my background is in a master's in health science. So I'm the guy who puts together the research, deals and manages with all the patients for our work in the NHS, as well as B2C, business to consumer stuff. So I kind of oversee the dietary protocols, manage patients. We have about 200,000 patients under our care in the NHS. So we specialize in cardiometabolic, so reversing type 2 diabetes, lowering cholesterol, reversing fatty liver disease, reversing sleep apnea, weight loss, all that sort of stuff. But I have a personal interest, for a very good reason, in autoimmune conditions, and especially to do with the idea that you can reverse many autoimmune conditions. And a lot of people don't know this. They just take their medication and they go on through life. They see a specialist who says, here's your cream for your psoriasis, here's your immunosuppressant for your joint pain, whatever it is. But I hope to bring you a new understanding of what autoimmune conditions are, the mechanisms that are at play, and also what the research says in terms of being able to put these conditions at a minimum into remission, potentially even reversing them, depending on what way you view both of those words. Okay, let me just share this for a second here. So, all right, so again, this is just a little bit about us. So we're very kind of sciencey led and data driven in our approach. The award in the middle there is for work we did in, I think it was 2021. It's known as the International Scholar Award for Improving Heart Health. That was from the American Heart Association. Interestingly, improving heart health on what's known as a ketogenic, lower carb or ketogenic diet, which is low sugar, low carb, high in fat. And we demonstrated that every measurable parameter of cardiometabolic health got better, meaning heart health improved dramatically on a diet that up until the last maybe 10 years, certainly, and in most people's minds still, should make your heart health worse if you believe the old school ideas that red meat and saturated fat are bad, and that we should be eating loads of calorie controlled processed refined carbohydrates instead, which we know now is very clearly nonsense. I won't go into that too much. The heart health side of things is really, really interesting and borderline obsessed with it. But anyway, the results speak for themselves. The outcomes speak for themselves. So that's the Paul W. White International Scholar Award for our paper on improving heart health. And then the other award to the right is the Clinical Pharmacy Congress Award for another paper where we showed about a 50% or so remission of or reversal of type 2 diabetes, reversing fatty liver, sleep apnea, and so on. Okay, let's get into autoimmune conditions. Now, when it comes to autoimmune, this is something that's very, very close to my heart. The reason it is when I was 12, we were dealing with, as we were told at the time, preparing for my mum's funeral. So my mum had a really, really severe autoimmune condition, which meant that her skin broke out in horrible psoriasis type rashes. She had extreme joint pain. Her muscles were attacking themselves and what we call atrophizing or catabolizing, so starting to waste away. And she couldn't walk. She had chronic fatigue syndrome. She was kind of chair bound, bed bound most of the time, and she was in palliative care. So we were preparing for her funeral. So she and my dad decided, I was maybe 12, 13 at the time, and I had a vague understanding of what was going on, but I was sheltered from it as well. She decided herself, I'm going to get one more opinion. So I think they refer to it as Sweet's disease, funnily enough. It's extremely, exceptionally rare. Now, the classification of autoimmune conditions is done predominantly by not so much the pathophysiology or the pathology of what's going on, but the presentation of symptoms. So the diagnostic criteria kind of revolves around the things that you present with. What I mean by that is, if you're tired all the time, you have chronic fatigue syndrome. If you have psoriasis on your skin, they say, well, that's psoriasis, clearly, because it's obvious. If you have joint pain as well, that's psoriatic arthritis. If you have a number of these conditions, we put it into a different category, and we call it just a kind of any number of, slice and dice variation and names for autoimmune conditions. So hers was called Sweet's disease at the time. There was something like 4 or 5 people who had it in the world, that severe. And out of the 5, 4 of them were dead. So she was told, look, no cure. You are going to die. You've 3 to 6 months, get your affairs in order. So she went for a second opinion. And the other guy she went to said, look, I've seen really similar stuff before from an autoimmune point of view. And this guy undoubtedly saved my mum's life, because he said to her, what I want you to do is take dairy out of your diet, take sugar out of your diet, take nightshade vegetables out of your diet, and follow what's known as an anti-inflammatory diet and see does it make any difference. Now, she had a plot picked out. She had the funeral arrangements half prepped, or at least she was letting my dad know what to do and what her wishes were. And 6 months later, she didn't have the disease. So that's why I'm so passionate about it. I mean, completely cured, completely cured. She had been on every medicated cream, NSAID, non-steroidal anti-inflammatory drug, ibuprofen. She'd been on the immunosuppressant drugs, methotrexate, all that like real aggressive antibiotic steroids, which in retrospect probably made things worse because we know now the connection between gut health and autoimmunity. So let's cover what, and by the way, I've put 2 of my own autoimmune conditions into remission as well, which I'll talk about in a second. Let's talk about what autoimmune is first, then I'll tell you about what the literature is showing in terms of how we treat autoimmune conditions, and just balance that off against what we call the allopathic treatment or the traditional Western treatment of autoimmune conditions, which is to take a medication and or cream, depending on the presentation, to address the symptom of the disease state, as opposed to getting to the root cause of what's causing it in the first place and trying to tackle that, which reverses most autoimmune conditions. All right, so an autoimmune condition is essentially your body, through one dysfunction or another, inappropriately attacking itself. So what I mean by that is, if you look at, I'm going to focus on mine, which was psoriatic arthritis, kind of an anxiety disorder, and psoriasis as well. So kind of joint pain. In my experience, psoriatic arthritis was horrendous joint pain. It was just pain that went into my back, would be in my knuckles, in my feet, and my knees, everywhere, elbows. And psoriasis, which is, you know, multiplication of skin cells, overproduction of skin cells, which causes a kind of a scaly type patches all over your body that can be painful, itchy, or just present. Technical term for this, psoriasis dermatomyositis. I can never pronounce that. So what's really interesting about autoimmune conditions is that they can present in a lot of different ways. Like, I often count myself very, very lucky that my autoimmune condition ended up being kind of a psoriasis, because it could just as easily have been multiple sclerosis. It could just as easily have been neurological. We see this quite a bit. It could have been my pancreas that was attacked, and that would be type 1 diabetes. It could have been my gut, and that would have been ulcerative colitis or Crohn's disease, gastrointestinal sort of autoimmune diseases. And it could have been a really bad joint presentation like rheumatoid arthritis. So often there's this idea that arthritis is just wear and tear. I was actually told by a specialist when I had horrendous arthritis in my early 30s, I'm almost mid 40s now. When I was in my early 30s, I was told, oh, it's just wear and tear. And I said, I'm 31. How can I have wear and tear? I'm young. It can't be wear and tear. And he was like, oh, everyone's different. It's just wear and tear. At the time when I had the really, really bad joint pain and the psoriasis, I was told it's nothing to do with diet. You know, eat healthy might help you a bit, but just take an immunosuppressant. No, the idea of an immunosuppressant is, we understand in autoimmune conditions that the body is inappropriately attacking itself, which is what you see in the literature. There is nothing inappropriate about what's going on with your immune system. Your immune system is doing exactly what it should for the environmental triggers that it's experiencing. So now, to feel inappropriate to you because you're thinking, why is my skin scaling up? Why have I got joint pain? Why have I got chronic fatigue? Whatever the presentation happens to be, whatever organ happens to express itself in. Autoimmune conditions, for the most part, are caused by, this is just a way I like to explain it. Your gut should look like this. And when you have an autoimmune condition, it starts to become permeable. You start to get little holes in your gut. And that can happen through stress, is one contributor of it. Diet can be another, if you're particularly sensitive to sugar, seed oils, refined carbohydrates. For some people, gluten. For many people, dairy. That's why people with autoimmune conditions will have raw dairy and kefir and things like that. And when you get that permeability in your gut, it's loosely referred to as leaky gut syndrome. Undigested food particles can get into the bloodstream when they should be getting absorbed through the gut lining and going through the normal gastrointestinal tracts. They go into the bloodstream and the body says, I don't recognize this, it's not fully digested, and I can see where it's going and I'm going to attack that system. If it's going towards the thyroid, you end up with a thyroid disorder. If it's going towards something to do with skin cells or that kind of a line in terms of the pathophysiology, that is going to express as psoriasis, eczema, rosacea, you name it. So, and this is a key thing. If you're suffering from psoriasis, the major breakthrough for me was understanding that psoriasis has almost nothing to do with your skin. Almost nothing. It just happens to be the end point that the inflammation is expressed at. Psoriasis is basically just a reflection of what's going on in your gut. So if you looked at your elbow and you thought of a really bad psoriasis patch here, you tracked it all the way down, all the way into your inside and into your gut, you'd see more or less the same thing. You'd see your gut was all scaly and inflamed and dysfunctional. So it's an expression of what's going on in your gut, which makes you wonder, and that's well established in the literature, well established, which makes you wonder, when you get a flare-up of psoriasis, why do we treat it with two things? Here's one. This is one from years ago for me. Dermavate cream in Silcox base or something like that. We treat it with that when we should be treating it with this, something for your gut to heal up your gut. So the traditional allopathic way of treating these disease states, this autoimmune state, is to blame your immune system and go, oh, your immune system's just gone mad for the crack. So, try rubbing some cream on it. Great, that's not going to help my gut. And, worst case scenario, then when it gets bad enough, let's, instead of wondering what's triggering your immune system and trying to do anything to help your immune system to be more appropriate, let's just take a medication to suppress your immune system, which is insane. And it brings a whole host of benefits with it as well. I won't go into the scary stuff that can happen with long-term immunosuppressant therapy, but just suppressing your immune system and almost inferring that it's doing something wrong is crazy, absolutely crazy. Your immune system is doing exactly what it should. So taking a cream and putting it on your psoriasis, which by the way will help in terms of the external symptomology, it will help. It'll ease the pain down. There'll be a kind of a steroid in it that will kind of ease the inflammation, but it won't stop it happening again, and it won't stop it getting worse if you have the wrong things triggering your gut in the first place. Taking a cream to ease the symptoms of psoriasis, for example, or taking an immunosuppressant to calm down your immune system from doing exactly what it should given the set of circumstances, is kind of like giving an antihistamine tablet and eye drops to somebody who's working in a field of flowers who's got extreme hay fever, and never removing them from the field of flowers. Just sending them back out day after day after day, back out to the field. Now you can take your hay fever tablets, you can take your eye drops, instead of saying, well, actually, should we not ask, instead of just addressing the symptoms, so the runny nose and the inflamed skin and the eyes and all that irritation to the eyes, what about we ask the question, what's causing the inflammation in the first place? And that's where we start to see autoimmune diseases disappearing. So that's roughly what autoimmune is. It's an inappropriate, or overactive is a better way to say it, response of the immune system that can end up expressing itself at various different systems, with the endocrine, nervous, skin, bones, gut. But the root cause is not your immune system just going wrong for the sake of going wrong. Your immune system is so clever. Your body is just incredible. It's not doing something inappropriate. It's doing exactly what it should because of the environmental triggers that it's perceiving. And here's the problem. So the vast majority of autoimmune conditions are both caused by and made worse by something called leaky gut syndrome. You'll see this 90% plus of people with autoimmune conditions will have gut dysfunction. And you'll often see this in psoriasis, for example. Psoriasis will sometimes be accompanied by joint pain, chronic fatigue. It'll sometimes be accompanied by bouts of anxiety or unexplained depression. And all of these can fall into the category of autoimmune. So in your gut, in what's known as your endothelial lining, or the single cell layer in your gut that prevents food and other pathogens from getting into your blood, you've got what are known as normal type junctions on the left-hand side of the picture here. Now, where you have normal type junctions, you get regular absorption of iron, B12, vitamin D, all of your various different micro and macronutrients, phytochemicals and so on from food, and everything works as it should, and there's no inflammation. Now, if you have a lot of stress, if you have a very sensitive gut, so you can inherit autoimmune conditions. So I have my mum to thank, for example, for the psoriatic arthritis and the various different psoriasis and things that have had asthma, all that sort of, asthma is autoimmune as well, all that sort of stuff. You can inherit that kind of predisposition or genetic proclivity to have an autoimmune condition. So you can come from a family that just have a fair bit of autoimmune. You'll often see this, you get 2 or 3 sisters in the one family with autoimmune. So the fact that you have a genetic proclivity for or a likelihood for an autoimmune condition does not mean that you're going to get the autoimmune condition, and does not mean that you can't reverse it. It just means that statistically you're more likely for it to be triggered. You're more sensitive, if that makes sense. Now, what happens is when you get inflamed, you get inflammation on the right-hand side here, wherever that may come from. Sensitivity to sugar and carbohydrate, gluten, casein, which is a kind of a binding protein in milk and dairy products. Sugar, definitely a big one. Smoking, alcohol. All of these things, the major one actually is prolonged antibiotic use. All of these things can cause a deterioration or breakdown of your gut lining, referred to as gut permeability. And those tight junctions break in between the tight junctions and even split the junctions themselves. And what happens is then you get, a medication, a supplement, foods you're taking, alcohol, dairy, gluten, some of these things that are more deleterious to your gut lining, get into the bloodstream, and the body says, I'm going to mount an autoimmune response or an immune response to this, and depending on what system that's going to, that's where you tend to see the symptoms. So in the case of psoriasis, that is skin cells. In the case of psoriatic arthritis, it's going into your joints. In the case of multiple sclerosis, it's going up through your nervous system and expressing as a neurological symptom, and so on and so forth. So we start to look at, previously we believed autoimmune conditions were this, and we've done this, by the way, with diabetes, we've done this with high blood pressure, we've done this with obesity. Look, particularly things like diabetes with obvious symptoms, and we say, it's in the family, there's not much you can do about it, and you take your medications and it gets progressively worse over time. Just take your medications, you'll be fine. Yet we know with type 2 diabetes that almost 1 in 2 people who go on a low carb or ketogenic diet reverse their type 2 diabetes. It's relatively straightforward to do. I know because I do it every day in my life. I work with people and I hear every couple of days. One of our patients in the NHS will send us a message. We'll get the medical report back, the numbers back in from the NHS, their medical record saying their what's known as HbA1c or glycosylated hemoglobin has gone from 80 down to 40. Some of these people are on insulin, glycoside, Flozin medication, really heavy medications, and have to come off them because their blood sugar levels improved so much and they've put type 2 diabetes into remission. And again, there was a little bit of backlash around this from some of the medical community initially, until it became, time for consensus statements from the American Heart Association and the American Diabetes Association to say, actually, turns out you can reverse type 2 diabetes or put it in remission, as they'd like to say. Same thing is happening with autoimmune. So even if you just go onto YouTube, I could quote 100 studies. Even if you just go onto YouTube and type in, and there's a reason I'm saying this now, carnivore diet reversed autoimmune. That's it. And just look at how many people are posting and telling their stories about getting rid of horrendous psoriasis, anxiety, IBS, ulcerative colitis, lupus, all sorts of multiple sclerosis, all sorts of stuff that you would have thought can't be cured. Now, the question is, why a carnivore diet? Now, a carnivore diet, by the way, I have personal experience with. I went through about 10 to 12 years of hell from a psoriatic arthritis point of view. When I first met my wife, Natalie, which is 15 years ago, something like that, I remember going on trips up to Dublin. My mum lived in Dublin at the time, and I remember lying down and almost being in tears, being in that much pain, with my lower back pain, and then it would permeate down through my elbows, and my ankles would be swollen and red and painful. I couldn't figure out what it was. I knew it got worse when I went to Dublin, which was interesting, because I go up to Dublin and go to the donut shops and just do the dog in terms of diet. And I used to think, is it because I'm walking around all day? I went to specialists and they told me it's probably because of your background in kickboxing and maybe you've done a lot of joint damage through that. Nobody said it was an environmental trigger. No one. Nobody ever mentioned. I went to a number of specialists. Then I started doing my own homework. And again, I have a background in health science. I do a lot of research. So I kind of looked into it and thought, what if it's environmental? So I changed my diet from a normal kind of a low fat, high sugar, drinking a bit too much alcohol, to what's known as a paleo diet, which was popularized by a guy called Mark Sisson at the time. He popularized the diet known as the blueprint, primal blueprint. So I followed that diet and noticed, oh, that's interesting. My autoimmune stuff got maybe 30% better, like noticeably better. Lost a lot of weight, felt better, mental health was better, everything. So went from that to a low carb and then ketogenic diet, which is a very it's restrictive enough in that you have to take out, bread, rice, pasta, cereal, potatoes, all that sort of stuff. So I went on that. Then it got another 20-30% better, and my psoriasis went away. I thought, wow. So I used to have psoriasis here. It was always in the scalp. I still have a tiny bit of it. I'd get outbreaks here. If my diet wasn't great, it would come out in my shins. But the joint pain still wasn't fully better. It would come and go, and I really couldn't put my finger on what it was. So I went really extreme. I went down to a carnivore diet, which is only meat, and my joint pain went away. Now, this is something I've been dealing with. I was told to go on autoimmune immunosuppressants. I was given anti-inflammatories, courses of steroids, all that sort of stuff, prescribed methotrexate, as was my wife, who also got rid of her autoimmune conditions. And I just kind of thought, that's wild. I've cured my autoimmune condition. So the one sort of experiment that I do every now and again where I go, this just can't be true. I know it's true because I understand the mechanism of actions, I understand the clinical literature, but I've also looked at it and thought, I don't know, maybe it's all in your head and maybe it just comes and goes of its own sort of free will. So every now and again, every few years, I make this stupid mistake of veering away from my diet, which is predominantly meat and organic low sugar fruits. That's about all I eat, with a little bit of coffee. That's it. I also have some raw milk and something called kefir, which is a fermented dairy, which has kind of beneficial bacteria in it to help, tighten up the junctions in your gut and help with your what's known as gut bacteria or gut microbiome, as you hear it referred to. Just a colony of bacteria in your gut, about 2 or 3 pounds worth of bacteria, believe it or not. So I'll veer from that every now and again. I did it at Christmas just a few months ago, and I decided, I was speaking on my podcast, a separate podcast for type 2 diabetes, and I was saying to patients, look, 1 or 2 days is not really going to hurt you. And I thought, why are you giving that advice to people and you don't take it yourself? So I was like, I want to take myself too seriously. Now, I've made this mistake before. 2 days after just starting to eat a normal diet, I don't mean picking out, no, I just mean having not, a few celebrations here and there, having a little bit of Christmas pudding, having whatever, the Yorkshire pudding with the Christmas dinner. On the 27th, I couldn't really walk. I went to play golf on the 28th, and I went down to hit a shot, and I had to say to the guy next to me, I'm so embarrassed, but is there any chance you could help me up? My whole body had just seized up. So, and I was in bed for a couple of days with joint pain. So just a real stark reminder to me that it's not worth it. So why a carnivore diet? Let's take a quick look at this. Now, contrary to what a lot of advocates of the carnivore diet, which again, really restrictive, you're only talking about eating meat, eggs, dairy for some people, but not for everyone. And in its most extreme form is literally just red meat and salt and water, fizzy water or whatever. That's it in its most extreme form. You'll see this popularized by Dr. Jordan Peterson, his daughter Michaela Peterson, who both had really, really severe autoimmune conditions. For Jordan Peterson, it was joint pain and horrendous depression. For Michaela Peterson, her psoriatic arthritis and rheumatoid arthritis was so bad that when she was 8, she had to have her ankles replaced. And that's about as 8 years of age. So they just had a real strong family history of autoimmune. And they eat that way. They eat nothing but meat, and both of their autoimmune conditions are just completely reversed, totally gone. So the reason you see this happening is not really because meat is so healing and so anti-inflammatory. It is, and this idea that red meat increases your risk of cancer is just nonsense based on epidemiological studies where they try to establish causation from a link or a correlation between two things. Just complete and utter rubbish. We've been eating meat for 2.4 million years. It can't suddenly start to try and kill us, but only since the 80s and only in the Western world, because it does no harm to people in remote tribes around the world eating huge amounts of red meat. So why does this help heal up your gut? The main reason it does, if you think about a carnivore diet, if you go extreme enough to eat only steak and mince and eggs and fizzy water, you're eliminating the other 60 to 70 possible triggers for the gut permeability and the inflammation that ends up expressing itself in the joints. So for me, if a little bit again about my story, but when I had that degree of psoriasis on the top left there, except it was on my elbows, it was in my scalp, and extreme joint pain. And for me, within about 2 weeks, it'll be almost completely gone. You can see it healing. I mean, I have photos from patients who just started on a lower carb diet, and they ended up doing meat and organic fruit and fizzy water and not a whole lot more. And their psoriasis just literally disappearing in front of their eyes. No medication, within 2 weeks, just disappearing, like half gone in 2 weeks. By 4 to 6 weeks, completely gone. It's just absolutely wild. So the main reason is you're pulling out the potential triggers for the autoimmune response instead of just rubbing a bloody cream on it and hoping that things get better, or worse again, taking a medication that just suppresses your immune system and stops it doing what it's supposed to do by design. So go onto YouTube and just type in. Now, the only reason I say go onto YouTube, and that will sound very anecdotal coming from a scientist, is the clinical studies can be hard for most people to read. They're very heavy in the way they're worded. But even just go onto YouTube and type in carnivore diet reversed might. That's it. Autoimmune, carnivore diet autoimmune. And you see people talking about reversing stuff you didn't know you can reverse. I'm one of those people. Now, this one is going to be confusing to some people. So Dr. Anthony Chaffee talks saying plants are trying to kill you. Dr. George Ely saying Little Shop of Horrors, the risks and benefits of eating plants. What they're talking about here is there are certain plants, and by the way, we have no dietary requirement for plants, including fiber. That one will confuse a lot of people. It's healthier to eat higher fiber foods if you're going to eat carbohydrates and sugar, because it buffers out the blood sugar response, but there is no dietary requirement for fiber. If there was, then there would be no such thing as the Canadian Inuit, the Hadza tribe, the Maasai tribe. Hadza is a bad example, actually, because they have some fiber, but the Maasai tribe and the Inuit tribes around the world, who for thousands and thousands of years, arguably hundreds of thousands of years, haven't eaten any meaningful amount of fiber and had better health than we do in the Western world. So these talks are both looking at the fact that if you have a predisposition or proclivity for being, someone who suffers from autoimmune conditions, plants can be very, very, very harmful to your gut lining. So some of the obvious ones for me, if I have sweet potato, garlic, onion, spinach, or any of those what we call nightshade vegetables, tomatoes are horrendous for it. I'll get an obvious flare-up in my psoriasis and psoriatic arthritis. So just something to be aware of. Many plants tend to trigger autoimmune, the exceptions being fruits. Fruits tend not to be too bad. So if you think about it from an evolutionary point of view, fruits want to spread their seeds. They want to be eaten. So they don't tend to have toxins that will try and dissuade you from eating them, whereas plants definitely do. You can see this. I mean, the spicier or more bitter that something tastes, the more it's trying to send a signal to its predators not to eat it. So, and plants are amazing, actually. You see some studies where in cornfields, where if you get a loudspeaker and you play a sound of an animal crunching on the plant, and then you test the acidic profile, the profile of the plants in the field down the road from it, they'll actually start changing their profile to become more acidic. So you can check the acid before, check the acid level afterwards, and the corn plants down the row, a couple of 100 meters down and in the field next door, will start to realize that they're being eaten and change their acid profile to try and stop the person from eating them. So, and a lot of those what we call plant sterols and what's the one that always drives me mad? Phytonutrients. I would say phytochemicals is a much better way of saying it. So for most people, they're fine, they're healthy, they're better than processed food. If you have an autoimmune condition, they can be seriously deleterious or harmful. So the first breakthrough in this sort of stuff was actually a long time ago. There was a doctor by the name of Dr. James Salisbury, hence the Salisbury steak guy, who said if you have an autoimmune condition and you eliminate all foods, all environmental toxins, and just eat red meat, water, and salt, you'll reverse it in a few weeks. So this is out there in the literature. It's been known for quite a while. And his book was called The Relation of Alimentation and Disease. So what things should you avoid? And I mean, the list is, I say kind of half facetiously, but at the bottom here, unknown, because the triggers can be totally benign to one person and then extremely harmful to the next. A good example of this was a patient of mine who said, no, I'm doing what you say. I'm just eating meat and organic fruits and all that sort of stuff. And I just said, just do me a favor. If you're still experiencing the joint pain, just knock out the organic strawberries. Knocked out the organic strawberries, all of his pain went away in 2 days. So, and you would think, well, strawberries can't be bad for you. You're when you think that organic strawberries couldn't be bad for you, you're looking at that through the lens of normal digestive function. So it would usually be the case. Now, 99% of people can eat peanuts and they're absolutely fine, but 1% of people will have an antihistamine response, and it could kill them. So, what's good for one person, what cures one person will ail another. It'll be cause sickness or inflammation. So the key ones I would say are very obvious ones to avoid. Dairy, for most people, is pro-inflammatory, with the exception of raw dairy, which most people can tolerate. So raw milk, which is actually really hard to get. We get it from a company called forgutsake.ie, guts, G-U-T-S, forgutsake.ie. They'll send you like 6 liters of raw milk. They deliver on a Tuesday. They send it out on a Tuesday. We get it on a Wednesday. We get 6 liters, and that does us for the week. Again, if I have normal milk, if my wife has normal milk, we'd see a flare in autoimmune symptoms. But the raw milk seems to be fine. Sugar, definitely pro-inflammatory. We know that without question. Gluten, for a lot of people, gluten can be a problem. In fact, I would say for most people, even if you're not celiac or sensitive to gluten, as far as you know, if you have an autoimmune condition, you probably are. Alcohol, undoubtedly pro-inflammatory and harmful to your gut lining. Nightshade vegetables, so like I was talking about a few minutes ago, these can be very harmful as well. And your nightshade vegetables are things like tomatoes, what else is there? Peppers, onions, garlic, all of those kind of leafy green vegetables. They can be very, very harmful for some people. Stress, without a shadow of a doubt, stress is harmful to your gut bacteria, your gut flora. From a gut permeability point of view, can harm your gut lining, so it's going to increase autoimmunity. And then antibiotic exposure. Antibiotics are, it's well established that they're worsen autoimmune conditions, and they may even cause autoimmune conditions, or certainly lead to the pathophysiology or add to the pathophysiology of autoimmunity. And then the last one, unknown, because there are some autoimmune conditions where it's very, very difficult to know what's triggering them. And that's why I would suggest, and it sounds so extreme, but listen, if you're listening to this and you've suffered with anything autoimmune, you would do anything if it gets bad enough to get rid of it. So for me, it was a ketogenic diet. It was getting rid of dairy. It was taking gluten and dairy out of my diet, and sugar, and just seeing what happens on a organic fruit, sparkling water, and red meat diet. And for me, my autoimmune conditions are gone. So it can be worth it. Okay, so key steps to take. Certainly an anti-inflammatory diet. At a minimum, trying a low-carb diet. I would definitely get rid of the obvious triggers like dairy, gluten, sugar, and alcohol, and even just try this for 3 or 4 weeks. Try it for 4 weeks. I want to see, does my psoriasis go away? I want to see, does my joint pain get like dramatically better in a couple of weeks? And that's how long you would want to try it for, 3 or 4 weeks. There's a case to be made that you could go back eating foods that you know are triggers to you once your gut lining is healed a little bit, but personally, I know I'll just flare back up if I do again. So it's sort of something you have to accept. Definitely avoid antibiotics. I'm not a medical doctor. I'm not trying to advise you what medications to take or don't take, but just at least discuss it with your practitioner, your doctor, and just say, look, I'm aware that antibiotics can, destroy your gut bacteria and add to gut permeability and make autoimmune conditions worse. And if your doctor says, no, they don't, they're fine for your gut, that's not true, just Google it. Just look up a study and say, can antibiotics make psoriatic arthritis worse, or eczema worse, or joint pain worse? And you'll see it's actually there in the insert in the package. Consume probiotic and fermented foods. So if you do have to be exposed to antibiotics, something like this, which is an organic kefir, which is just kind of a fermented or soured, sounds awful, fermented or soured yogurt, that can be very helpful. And fermented foods as well. So fermented foods would be something like kimchi, sauerkraut, all of those kind of even seaweeds and stuff like that are fermented. But they're really, really popular in Japanese and Asian cultures, for example, because they understand the importance of populating your gut flora. But certainly, if you have had antibiotic exposure, you want to be having a little bit of that kefir. Like a couple of tablespoons or just a sip out of it as you pass the fridge a couple of times a day to repopulate your gut bacteria, because antibiotics indiscriminately kill good and bad bacteria. And obviously you want to kill the bad bacteria that's causing the issue that you're treating with the antibiotic, but you don't want to wipe out all of your good bacteria as well, which is what you do more often than not with antibiotics, particularly prolonged exposure, so more than kind of 4 or 5 days. And start an elimination diet and just see what happens. What have you got to lose? If anyone wants more information on this, guys, just reach out to us, leave a comment, and book in for a consultation if you're someone who has access to free consultations as part of our corporate deal. That's it for the moment, guys. I hope that's been of use to you, and I hope it's given you hope as well if you have an autoimmune condition, because I know it can be hopeless and just feel terrible when you're thinking, you know, what do I do? You're going to a doctor and he's saying rub cream in it. You're going to a specialist and the specialist is saying suppress your immune system, and nobody is asking the question, nobody, why is this happening in the first place? And once you get to the root cause of why it's happening, which is every time an environmental trigger, remember, your immune system is not dysfunctional. It's doing exactly what it should be doing given the set of circumstances. And that circumstance is gut permeability, gaps in your gut lining, fractured or split junctures, which are allowing undigested food particles and everything that goes through your body to go into your bloodstream, and your body is mounting an immune response to it. The problem is not the immune response, the problem is the trigger. So again, think of the, and it's a decent analogy actually, but what we're doing when we rub the cream in it and take the immunosuppressant is we're sending someone with an extreme hay fever or pollen reaction out into a field full of flowers in the middle of summer at the height of pollen floating around the place, and we're just giving them an antihistamine and eye drops. That's what we're doing. So that's what you're doing. And until we remove that trigger, that environmental trigger, it's never going to get significantly better, and it's certainly not going to go into remission. Guys, thank you for joining me. Appreciate you being here, and we'll see you in the next one. Take care.